Tuesday, July 23rd, and this is the County Operations Committee meeting. So we will start with the approval of the minutes for May 29th. So I need a motion to put that on the floor. Dr. Blair and Mr. Renaud. Any changes, amendments, corrections for the minutes? Seeing none, I'll ask for a vote. All in favor with the sign of aye. Aye. Those opposed with a nay? The ayes have it. All right, we'll move to informational items. The first informational item is the workforce report. I'll pass it over to Administrator Sorrell.
Thank you, Mr. Chairman. So you'll find that on page 3 in your packet. This represents activity through June 30th of this year. Top third of the page shows applicants and hires during period 6, or the month of June. Just as a note that we say for anybody watching, the number of hires in the month of June does not automatically reflect the number of applicants in the month of June, as the hiring process is sometimes more than 30 days. The middle of the page has our workforce demographics, and in comparison to the demographics of Peoria County as a geography. And then the bottom has separations. So happy to answer any questions.
Okay, any questions from the committee on the workforce report? All right, seeing none, we will move on to the vacancy snapshot report.
All right, that's on the following page in your packets. You'll see that currently we have roughly 82, almost 83 positions vacant, and at least for the period, so this would be again ending June 30, which is roughly in the 12 to 13% range for the entire organization. There are obviously departments that have a higher vacancy rate and those that have a lower vacancy rate. So happy to answer any questions about this.
Okay. Any questions from the committee on the vacancy report? All right, midway through the year, that's fairly typical. We will now move to the liability and work comp report.
All right, this is on page 5 in the packet. Top half of the page are liability claims by year, so this is everything except workman's comp. You can see for the current year, we have 4 active claims, which means we've resolved 1 of them because we've had 5 filed to date. We still have 4 open claims from 2018, 1 from 2022, and 4 from last year as well. And then top right is how that looks financially and what the reserve remaining is and how much we've paid to date. You can see for this year, so far, pretty small exposure. Our largest exposure is from 2018. Bottom half of the page is workman's compensation. You can see that for the current year, we have 24 claims filed, and 10 of those remain active. Across the history that you're seeing, we have 2 of the 54 cases filed in 2021 still active, 5 of the 56 cases in 2022 still active, 3 from last year still active as well. Bottom right corner puts the financial information to those claims, and you can see that biggest liability at this point is 22 and 23, where we've got 178,000 and 163,000 reserve remaining, respectively. Happy to answer any questions.
Questions from the committee? Again, this is a good report that kind of gives us a good one-shot view of our liabilities and outstanding. If we have no questions, I do have one additional information item I'd like to slide in here at the moment. For those who last Friday were impacted by the CrowdStrike impacts, if you were traveling or anywhere else, the county wasn't immune to it. And so I've asked CIO Little to come up and provide a a few comments of how the county was impacted and how this IT department processed and handled that to minimize the impact. So I'll turn it over to Mr. Little.
Thank you, Mr. Chairman. The chairman and I had a call on Friday afternoon. I provided him an update on how we were impacted. I know there's been lots of information out in the news, we did have an impact at the county. We do run this CrowdStrike software. That software is provided to us via the state of Illinois. And this, to set the record straight, it was not a cyber incident and it was not a Microsoft incident. It was a piece of software that is updated multiple times a day from CrowdStrike. Identifies viruses, ransomware information on all our devices. We run it on all our end user devices and all of our county servers. 100 plus servers, over 1,200 end user devices. And it's a process that occurs behind the scenes. CrowdStrike's been around for 10 years, so it's a process that's been going on for 10 years. CrowdStrike's a very large organization, about a $3 billion organization with 9,000 employees, so a pretty good sized organization. And they have somewhere between 20 to 25% of the market. Like I said, we get CrowdStrike via the state for free. We don't pay for it. And our information feeds up to the state security operations center, so there's a 24-hour center that monitors that for us. We found out about it Friday morning, just after midnight. I have a couple of one of my senior network engineers who does a lot of work late at night on stuff when nobody's here and during those hours. And he happened to be online and saw that we were starting to lose servers. Literally, it just starts shutting down servers. They go blue screen. I don't know if you've all seen what we define as the blue screen of death, but your screen goes blue and you're stuck. That started happening on our servers just after midnight. He made a call to the Security Operations Center for the state of Illinois, then immediately came on site, started doing some research, and it was known rather quickly what was causing the issue. And so out of our just over 100 plus servers, that were into 53 of our servers. So 53 of our servers had blue screened. At that time, he was on site. We brought in our other network engineer. Between the two of them, by 4:45 in the morning, they had all our servers back online. So we were up fully functional, fully operational, and all our servers were hosted here. About 3 in the morning, we also brought in one of our field service reps because we knew it was impacting our end user devices. And so from a criticality point within the courthouse, the first place we started looking was the courts and the circuit clerk's office, especially the counter in the circuit clerk's office. So we started at that time going through checking machines. Then at that point, we didn't know. There was no tool to say, all right, it's this machine, it's this machine, it's this machine. And we really didn't find any consistency. We'd been told, well, if the machine was off, it didn't happen. And if it was on, it did get it. Well, we found both to happen. So my call to Scott first thing in the morning, his first question was, can we open the courts? And we did. We got the courts back up and running immediately. So we brought all staff in, got together with staff. We even pulled in our app support staff, our GIS staff, and came up with a plan and started. We sent 2 folks out to the jail to start, and we started in this building in the courts first and then worked our way through the day. We found out of our over 1,200 end user devices, only about 10% had been impacted. Challenge is that you just can't reboot and it comes back. You have to go in and physically remove a file, and that's not something you can do remotely. For those of you who are computer savvy, when you get that what we call the blue screen of death, you have to go into a safe mode. And because of multiple layers of security we have on our desktops, it took us 2 other steps to get through. So it was not an easy, quick process. But by the time we left at 5 o'clock on Friday, we had everything that we knew about fixed and repaired. And that was due to the efforts of the IT staff. I mean, everybody came together. We put together a plan and sent them across the county and checked everything. Still doing a little cleanup from yesterday and today. For people who were either gone on vacation, out, had laptops with them. We didn't get those until they got back. From systems that are hosted outside of the county, our finance system did not get hit. It stayed up. Our intergrowth system, which is the planning and zoning system, it was down for, I would say, a good part of the day. That system came back up in the afternoon. First thing in the morning, our time and attendance system was down. That's hosted externally, and then it came up somewhere between 8 and 8:30. The only thing at the moment that we're still working on is our GIS portal server. When it went down, it corrupted some Esri files on that server, and those are some internal applications specifically that there's not a large group that internal groups use. It's not our external piece of GIS, it's internal. We're still working with Esri on that. We're not the only one to have that problem. Yesterday we did some digging and found it's happening with a lot of folks. So Esri is very busy right now helping their customers try to recover from that. Just some numbers. Even though this was probably the largest IT impact that I've seen in my career, which is 31 years now, it only hit 1% of the install base of Microsoft Windows. So as of this morning, the numbers are hit about 8.5 million systems across the world. So, and I know a lot of those folks are still working on recovering. I just read before I came up here, Delta Airlines is still trying to get things straightened out. So we implemented our processes we have in situations like this and went through, and it worked pretty well. So I think the impact on the county as a whole was very minimal. I judged that by phone calls I would get, and I didn't get any phone calls on Friday over the weekend, and didn't have Scott bother me. So in my eyes, that all went pretty well. So any questions?
All right, thank you, Mark. Any questions from the committee? Again, it wasn't a planned test pilot of how we react, but it turned into a reaction and how well we were prepared.
We thought early on it was a cyber incident, but it wasn't. Yeah. So, got a little exciting for a while.
Well, and it also brings to our attention how critical the IT infrastructure is to running operations, the courts, everything we do here. Essentially, you shut down IT, you pretty much shut the doors and probably tell people to go home. So again, thank you for the update and your team's response, taking care of those issues. Don't know if there's really anything else proactive we could have done. Sounds like everything that we did was required to be done to react to it, to remove the application that was bad and get it corrected. So one more round. Anyone else in the committee have any comments? All right. Well, thank you and your department for the work they've done. All right. We will move to the last informational item. It's our quarterly strategic plan update. So that is in your packet, and I'll turn it over to Administrator Sorrell to walk us through the operations section.
Great. Thanks, Mr. Chairman. So if you're on your iPad, it's page 11 of the packet. This committee has 5 strategic plan goals or action items tied to it, with a 6th one that executive committee has primary oversight over, but we report out here as well. So just some highlights from each one of those items. I'll walk through them quickly. Workplace culture strategy, what work that was done in the 2nd quarter here was creating a pretty comprehensive workforce and team member survey that's going to be put out into the field in early August, and that'll give us a good baseline as to where we're at and to create some initiatives based on the feedback that we receive in that survey work. Goal number 4 is succession planning. You'll note there's no activity there because it's scheduled to start in the 1st quarter of next year. So there really won't be an activity on that until then. Number 8 is the health insurance affordability plan. There's 2 resolutions on the agenda later today, so we'll be spending quite a bit of time talking about health care and health insurance for our workforce here in a couple of minutes. But just would like to highlight that the Health Insurance Advisory Committee, which had representatives from our bargaining units, from management, from this committee, and a wide cross-section of team members from across the organization, really leaned into finding the best solution for our workforce, and did a yeoman's job in navigating the complexities of health insurance today. So for those plan members, those committee members that are in the room, and there are some, I really appreciate the committee's work and their work. Next up is goal number 9, which is the DEI plan. This is the one that officially goes to executive committee, but we share out here as well. Just 4 things to highlight here. We developed and pushed out 4 DEI-related trainings. We've started to look at a comprehensive amendment to the purchasing ordinance, which will do more than just associate DEI goals. There's some other things that need to be changed that would allow us to be better aligned with changes in state statute. We also have the W-9 project, where we asked all of our current vendors to resubmit W-9s. They've done that. Where the status is of that is currently is that we are now going through the process of hand keystroking all the data points from those returned W-9s and getting them into our vendor database. Once we have that complete, then we'll be able to give a good baseline of purchasing history with minority, women, disadvantaged, and veteran-owned businesses. Third, we've identified and started to make relationships with 52 different external stakeholders as it relates to whether mostly in the minority business procurement side of things, but also in terms as it relates to external stakeholder engagement. And then fourth, as we there will be a resolution on the executive committee agenda today, which is related to a grant that the county's been awarded for a digital equity pilot project. Goal number 13 is internal branding strategy. Most of the second quarter was spent creating and implementing and rolling out rebranding in our newsletter, on the intranet, and other communication vehicles that we have. And then the last action plan item, number 14, professional development strategy. Most of the work here that was done in the second quarter, again, is tied back to that same workforce survey that I mentioned at the very beginning, because they're directly related, and we're going to take advantage of a survey opportunity to ask some key questions about professional development, some key questions about workforce culture, and some key questions about DEI. So that's a very quick, high-level summary of the action plan items that this committee has oversight over, Mr. Chairman. I'm happy to answer any questions.
Okay, thank you. Any questions from the committee on this update? Okay, I think it's important that we keep the quarterly plan report out in front of us, make sure we're progressing the way we plan. One of our agreements when we did the strategy was we're not putting this on the shelf. It's a living, breathing. I know some of us have been very persistent on staying on it, so thank you for the administration and all the people who have been working each of these plans. With that, we will move to the first resolution. The first one is the Axon Digital Evidence Software for the Public Defender's Office, and this will be joint with the Finance Committee, so they'll bring up the same. This is coming through our Operations Committee because it's being implemented by the IT department, and the Public Defender's Office will be the user of the service. So we have our CIO here, and we have Kevin Lowe as our Public Defender to speak on this. So I'll first ask for a motion to put this on the floor. Mr. Phelan and Ms. Coates as a second. So with that, I will turn it over to the two-person team to present this.
Thank you, Mr. Chairman. This is coming to the Operations Committee for approval of $44,700 in surplus reserve from the IT Service Fund from the 2024 budget to implement the Axon Digital Evidence Software in the Peoria County Public Defender's Office. Axon, a little background, Axon is the camera system that is currently in use by the Peoria Police Department and our Sheriff's Department. Also in 2022, the Peoria County State's Attorney's Office implemented this version of their software within their office, so they are currently managing all of their digital evidence via this piece of software. This came about from discussions we started to have with the Public Defender's Office following their move into the new space on other things we could work with them on from an IT side to improve processes and things within in their department. And this was number one on the list, was how they manage their digital evidence. So I'm going to turn this over to our public defender, Kevin, and let him talk a little more about the process we went through in the demo and what they saw and what it can do for them.
Yes, thank you, Mark. Kevin Lowe, the Public Defender of Peoria County. My involvement actually started with a conversation with our state's attorney, Jody Hoos. She mentioned that their office has been using the Axon Justice System for quite a few years, and she believed that we could achieve some efficiencies by also obtaining a license so that we could directly share evidence between the two departments. Axon Justice is fundamentally a discovery management system, and I know some of you have heard me talk about discovery before. In a criminal case, each side has to share all their evidence with the other side. So in a typical criminal case in Peoria County or any county, usually the state's attorney sharing the bulk of the evidence with the public defenders or with the private attorneys. We have body-worn cameras. Those are huge files. Those are a lot of files that we get typically. And your average retail theft case, a very simple type of class 4 felony, you might have 2 or 3 body-worn cameras, 1, 2, 3 surveillance cameras, 2 or 3 squad car cameras, and then on top of that, you also have, of course, the police reports. The police reports themselves are no longer rendered on paper; they are all digital. They are PDFs, right? So a discovery management system actually becomes a digital evidence management system, and that's what Axon Justice does. I spoke to Jody Hoos on that occasion, and then probably a month later, I talked to Deb Shelby, who's I think the chief of their criminal division in the state's attorney's office, and she also implored me to talk to Mark Little about potentially getting this system so that our departments could once again share this information. Because up until now, the way we've been doing it is that the state's attorney has access to the Axon system. So they figure out which items of evidence they need to share with us, and they bring it to their assistants. Their assistants look through it. They look through their interface. They essentially download it or prepare it for a potential download and provide a link that they then send to our office. Our office then gets the link, sends it to the right person, then downloads it onto hard drives or DVDs or DVRs or thumb drives, hoping that it gets to the right attorney. It's a pretty inefficient system. So immediately, that's the one efficiency that I see happening, is that both sides will be involved with the same system. We'll have an interface. The state's attorney will have an interface. We share files back and forth, and it's all done right there in the digital space in the computers. We don't have this whole downloading or sharing of links going back and forth. As I've said before, it's a huge volume of cases, so it's really a logistics nightmare when it comes down to just trying to manage all these links that we receive from the state's attorney's office and getting them all downloaded to the correct attorneys. Beyond that, I think Mark touched on it a little bit also, is that this is a comprehensive suite of tools. It's not just sharing of discovery materials. It is, we can use it to digitally edit the materials as well. Oftentimes in preparation for trial, we're receiving body-worn cameras or surveillance evidence. We have to go through all of that. we have to listen to it, watch any interviews, sometimes transcribe portions of interviews or all the interviews. And in preparation for trial, we have to edit certain clips that we might be introducing into evidence in the event we need to use it. Or impeaching a witness, say. If a witness comes up and says something that was different than what's on the body-worn camera, well, we want to have that clip there available just in case that witness doesn't say what we anticipate they're going to say, and then we'll have that clip. Well, this system makes it very easy to do that and very efficient because it has digital editing of the files. It has digital redaction built in. Very importantly, it has something that is AI-based, artificial intelligence based, which is automatic transcription of videos. And this, to me, is just a huge thing because we receive such a large volume of body-worn cameras and interview videos that it is very time-consuming and very laborious to sit there and watch all of these videos and then potentially transcribe everything by hand. When we have a system that can do it for us using AI technology, based on the demo we saw, it appears to be very accurate, very fast. It'll transcribe. It does it side by side with an actual video. So you'll have a sidebar, you'll have the video itself, and then the transcription occurring in real time as you watch the video. And you can earmark and bookmark certain spots that you need to come back to. Then on top of that, not only will it just it'll transcribe the entire interview, but it'll create an AI summary. This is very important, very helpful in cases where you have a murder case where we might have 30, 40 body-worn cameras that we need to process. This program will process it all, provide a transcript, and also summaries of each of those individual videos so that our attorneys can very quickly identify what could be areas of interest that they need to look at first. I'd tell you, when we sat through that demo, I was there online. It was via Zoom. Mark was there, our office manager, I believe our first assistant. It's very impressive. It's a very powerful suite of tools, and it'll help us do our job much more effectively, much more efficiently. And I'm looking forward to it because I was very, very impressed. I'm hoping this is something that we can do for the Public Defender's Office. Thank you.
Okay, no, thank you, and thank you for the details. I'll pass it out to the committee for questions. Dr. Blair?
Mark, can you talk a little bit about the security of this and whether the prosecution and defense can see what each other are doing?
They cannot. Two separate entities. They're set up separately. This is a cloud-based system. It is not located here. It's in the Exxon cloud. They host it. The other positive thing is that it comes with unlimited storage, so they're not restricted on storage. But no, the way the entities are set up, they can't see what each other's doing at all. Once they pass those files back and forth, that's all they see. They pass it, it's gone. There's nothing else in common. They each handle their security separately. So yeah, there's no, the only togetherness is passing the files back and forth. Beyond that, they're very much separate.
Well, that's a good question. We want to make sure that the reliability of our process doesn't corrupt the procedure and such. So appreciate that. Any other questions from the committee on this ask? All right. With that, I'm going to call for a vote. All in favor with the sign of aye? Aye. Aye. Those opposed with a nay. All right. Passes unanimously. Thank you. We will now, give me a second, we will move to the second item is the approval of the ordinance and one-year contract and bylaws to join the Intergovernmental Personal Benefits Cooperative to provide health insurance benefits. So I need a motion to put this on the floor. Ms. Allison and Mr. Phelan. Okay, so as I'll kind of intro this, as Mr. Zorell presented in our strategy, one of the things that's been working is the Health Insurance Advisory Committee, a great team of people throughout the county to get to this point. Shauna has been deeply involved in leading, and I would say Angela's probably right in there day to day working it. And we've got some of the team members from that committee here. Again, for those team members that are here, thank you. For those who are not here, I want to also extend a thank you, because a lot of work, a lot of effort. So with that, I'm going to pass it over to Shauna to give us an update, her and Angela and whoever else they'd like to bring in.
Thank you very much. So, couple things that I'll walk through real quick. I'm going to give an overview of the process, because I think the process this time around was very important. And then I'll get into some of the specifics of what the pooling arrangement will be. And then we can ask questions as we go, however you want to do that. And I'll do some introductions as well. Very excited to be here today. I think this is a really good turning point for us as an organization with regards to our employee health benefits. As we have talked about with the committee before we even jumped into this process, and some of you were here 5 years ago, we issue a request for proposal for our health benefit structure, and every 5 years. So we typically enter into 5-year contracts. The 5 RFPs that are historically issued and were issued this time around, we do one for wellness, we do one for a fully insured, so that'd be like your United Healthcare, your Blue Cross Blue Shield, Aetna, those types of plans. And then we also issue a self-insured package, which is 3 separate RFPs. The first is a third-party administrator, or TPA. That is our claims adjusters. The second is our pharmacy benefit manager, so that would be like our drug card. And the third is our Preferred Provider Organization Network, or PPO network. And we have been with Unity Point Health, and now Carl, and previously back in the day Methodist, for a number of years. I have been here 22 years, and we have been in those networks. We bid them every 5, but again, they were always the winner based upon a number of different factors. So that's kind of where we've been. And so this current package expires December 31st. Our contracts, we're currently self-insured, and those contracts all expire December 31st of this year. So in January, at the direction of the committee and Chairman Ricker, we established a new Health Insurance Advisory Committee, or we tend to call it HIAC. So HIAC, I think, is what we had in the agenda brief. And so we have some members here today. From a staff perspective, Angela and I staffed that. Scott was a member, Jenny's a member, Heather is a member, and then we have some others here today. So we have Rossi Vonk from elections. We have Austin Weishaupt, sorry Austin, from probation. And then we have the HR team, and we have a couple new HR team members, so I'm going to go ahead and introduce them as well. Vicki Willis is not new. You would probably know Vicki. She is retiring at the end of August. We're not going to talk about that today because I'll cry. I'm going to miss her dearly. But we have Christine Carbaugh. She is a new employee, and she started early July. Is that right? Early June. I'm all mixed up on my dates. I'm sorry. It's my second day back from vacation, so be easy with me today. Thank you, Christine. So Christine is an HR generalist, and then we also have Amanda Patelli, and Amanda has been with us for not quite a little over a year. 8-9 months, so not quite a year. And she is another HR generalist. And then we just backfilled our final HR generalist vacancy due to retirements, and she will be starting with us August 1st. So we're very excited, and Angela finally has a full team again, so she's happy too. Okay, so introductions, and if any of you have anything you want to add, feel free to jump in as we go. And we also have Bonnie. Bonnie Eaton is one of our healthcare consultants from Unland. So I know many of you have met Bonnie multiple times, but I did want to make sure you knew that she was here today as well. Okay, so we established the HIAC committee, and that was established in January. We started meeting every other week, and as we moved through the process, we started meeting weekly. So we were meeting for about 2 to 3 hours a week to review proposals and make our selections and things like that. Before we went out for RFP, we also wanted to hear what the employees, get some employee feedback. We've been hearing a lot of things anecdotally over the last couple of years, and so we wanted to see what was important to our employees. So we did an employee survey, and basically what the survey results came back were things that weren't necessarily surprising to us, but it kind of was not kind of, it was very helpful for us as we went through the RFPs to make sure that we were also addressing the needs of the employees. So a lot of the feedback that we received was that employees wanted affordability in the health benefits that were offered, related to premium, related to deductible, related to co-insurance. And co-insurance, if you'll recall, is you meet your deductible, and then in our instance, currently the plan picks up 80%, and then the co-insurance for the employees 20%, and then also co-pays. We currently do not have co-pays offered on our plan, and employees had stated through the survey that they would like to potentially see some co-pays offered in the future. One of the big themes throughout the survey was network choice. So currently, we have what's called an exclusive contract, and that is with Carl for our PPO network, and employees wanted the ability to choose a network, not just Carl, but have the choice to be able to go to, for example, OSF and have it still be processed as a network. That's something they're not able to do today. And then finally, they wanted to see some increased coverage options related to mental health benefits and vision benefits. So that was kind of the lens with which we were evaluating some of the proposals as well. So the the RFPs hit the street in late February or early March, and responses were due back in by April 18th. And so we really focused with HIAC on education, reviewing employee survey results, and all those things to make sure that we were all up and running and fully educated on everything when we received those RFP proposals. I know we have a few members of HIAC here today, but I did want to explain the committee also included one representative from each labor unit. So we had a representative from every labor unit, and then we also had an equal number of representatives from of non-union employees, stretching not only in elected officials' offices, but also appointed offices through Scott. So we had a really good representation, we felt, across the organization, and some were frontline employees, some were senior managers, so we really tried to make sure that we were hitting all the different areas of the employee base. Okay. So as we went through the RFPs, again, we issued the same 5 that we do all the time. We also worked with the state's attorney's office to say, look, there are some other publicly procured options that we have that don't necessarily go through our bid process. So, for example, the state of Illinois has, through CMS, they have a local government pool available to local government employers. In the past, we were not necessarily able to review those because they did not submit them through our RFP process. But working with Jenny and Jody and their teams, we were able to determine that because they were already publicly procured through the state, that it would not violate our purchasing policies if we were to request a quote for those. So it was, I think, a really good opportunity for us this time to expand the types of arrangements that we were able to review versus just going fully insured or self-insured. Okay, any questions about process before I jump into the actual contract? Okay. All right. So we internally, as staff worked with Unland to review each of the RFPs. So in working then with HIAC, we had to figure out a way to kind of control the chaos, right? Because it's 5 RFPs, there's a lot of different numbers. So what we did is we went through strategically and said, okay, we are going to look at all of the fully insured proposals and then select a vendor for fully insured. Then we're going to go through the wellness and select our top vendor for wellness, same with the TPA, PPO, and PBM. So we chose, if we were to go with one of those organizations, which vendor did we like best out of each of those 5 RFPs? Then we looked at it in terms of the type of model that we do. Do we want to stay fully insured? Do we want to go into a governmental pool similar to the IPBC or the state of Illinois? Or do we want to remain self-insured? So we, in order to compare apples to apples, because they're all very different models of how we do things, we asked them all to provide quotes based upon our current plan design, okay? So that way we knew we were comparing apples to apples. So fully insured, as was in the agenda briefing, the fully insured model with the would have been somewhere between 7.7 and 8.8 million, depending on a couple little nuances of options that we had with those vendors. A self-insured package, which again, that is your third-party administrator, preferred provider organization network, and your pharmacy card. When you combine all three of those contracts together for a self-insured model, that was between 8 and 8.4 million. And again, these are all in your agenda briefing. And then the pool with the selected pool vendor would have been between 7.4 to 7.6. So those would be the pricing for those should all things remain the same. We then, we not only evaluated based upon cost, but again, this is one of our largest procurements that we do, and one of our largest opportunities for recruitment and retention. And we had done the survey. So we went in and looked and we said, okay, what gives us the best options related to what employees have said that they wanted? Looking at it not just from the employer fiduciary responsibility, but also what employees want. And going through that process, HIAC recommended to staff that we go with the IPVC as our pool. And so there's a number of different reasons why. Obviously, cost, that was the least expensive model based upon the quotes that were provided. And it also gave us network choice. So with the IPVC, we would be in a Blue Cross Blue Shield network, which gives employees the option to use Carl or OSF. We had, I believe it was the fully insured model. You could choose Carl or OSF, but once you chose one, you had to stick with it. You could not go to a Carl pediatrician and an OSF podiatrist. Once you chose one, you had to stay with it for the year. With the pool Blue Cross Blue Shield model, employees can bounce back and forth based upon their needs. So if they want to go to a specialist at OSF, they can, or if they want to go to a pediatrician at Unity Point, or I'm sorry, Carl, they can do that as well. So it gave them the most choice. One of the other benefits with the pool, let me back up a second. One of the benefits of being self-insured, as we currently are, is if we have a good plan year, like we did in 2023. The audit came back in and we had budgeted for $8 million in costs in the employee health fund. That's overhead, claims, prescriptions, everything. The audited number came in around 6.9. So we had 1.1 million in savings. We came about 1.1 million under budget. Because we were self-insured, that money stays in the employee health fund balance. So we are able then to use that for future costs. In a fully insured model, if we had been fully insured, the Blue Cross Blue Shield, United Healthcare, Aetna would have kept that money, right? Our rates the following year may have been slightly reduced or may not, but they would have kept that money. The pool is kind of the best of both worlds in that we pay the premium in, and then at the end of the year, after the audits are completed, they do a true-up, and they pay us dividends. So we would get that back to go back into the employee health fund for future costs. The pool does not keep that money. And so it works like a fully insured model, and we're in a fully insured network. But because the pool itself is self-insured, then we get dividends back from that. So that was a really big selling point, not only for the committee, but for county administration as well. And then again, there's just a number of different options that we have with that expanded network in terms of types of coverages and things like that. So HIAC recommended to staff that we eliminate our self-insured program effective 1/1/25, and we move into the IPVC pool. So that is what is before you today. A little bit about the IPVC. They have been around since the 1970s. They are the longest serving governmental employer pool in the state. They have 164 governmental entities that currently participate in their pool. So it's a very broad risk range. In the last 11 years, only 5 employers have left the pool. So again, to us, that was a very good sign that people are happy when they get in. And unlike other pools, the IPVC pool, should at some point we decide that we don't want to do a pooling arrangement anymore, we do not have a buyout cost to leave the pool. And so, again, I think as staff, we were very comfortable with that in reviewing the proposals. That was our recommendation. There was a consensus, I think it was a unanimous vote at HIAC the day that we chose the model to move forward with that. So next steps. Today, what is before you is to adopt the contract with the IPVC. Prior to the August 4 meeting, we will need to have a special committee meeting to adopt an ordinance that saying we agree with their bylaws. They require us, that's what we're working through with them, is the wording of the ordinance. So we just want to make sure that we have all of our ducks in a row. Once the county board approves that, then it goes to the IPBC, to their executive board, and then they vote if they're going to allow us in. We don't anticipate any problems there. There are a number of larger counties in the state in that pool as well. McHenry County, for example, I believe Lake County. So there are some other counties, not just municipalities, in that pool. But those are just some housekeeping things that we need to do in order to be able to get everything in place so we can run our open enrollment, because we will have to transfer everybody into their system and things like that. Okay, I just did a lot of talking. So do you have questions about the process, questions about the contract? I don't know if any of the committee members want to say anything.
Any comments from committee members? It's your opportunity to speak on behalf of, your fellow employees. We'll come back to you if you have questions or comments you'd like to share. I want to pass to Dr. Blair for a question.
I just want to reiterate what our chair said. Thank you guys so much, both to the HIAC committee, Shauna, Angela, and all their staff. We know this has been a gargantuan task to work this out, and I'm really happy that this provides employees with more choice, and I'm looking forward to seeing what the premiums are going to be.
That's step 2.
No? Good. Mr. Renaud.
Do we have any bargaining units that still bargain for healthcare premiums?
Yes and no. So the 3 contracted the sheriff's office, corrections lieutenants and deputies, they have the ability to bargain their premiums. The contracts that you just approved were through the end of this year. So we will be getting back to the table probably here in the next 6 weeks, I would anticipate, with them. We would like to get premiums for 2025 hammered out prior to open enrollment if we can. We do have language in at least, I believe, 2 of those 3 contracts related to if we don't have an agreement by open enrollment, what then happens in 2025. But for now, everyone's good through the end of this year, and then we will be getting back to the table in early fall about that. We've not been able to do that yet. As I said, step 2 with Dr. Blair is the premiums. Once we finalize this contract, we've actually already submitted, we started the plan design and premium conversation with HIAC a few weeks ago, and we went back to the IPBC and said, okay, you're going to be the vendor that we're recommending, and now because we won't be self-insured, we can't have our current plans, we need to choose plans within that Blue Cross Blue Shield model, and they have a set plans that we can choose from. We asked them to give us some quotes on a couple of different plan options, and they're working with their actuary, Milliman, right now to come back and get us quotes on that. And then that second step is then we are going to run some models on that to say what would premiums look like for each of those plans. We're going to go back to HIAC, and then we will again have a second set of recommendations from HIAC to admin to the board regarding premiums and things like that. So we can't really go in and bargain those right now until we know what those premiums look like, and we're just waiting for them to get back to us.
So as a follow-up, then, since we're no longer self-insured and the premiums will be set by somebody else other than the board, if the premiums are more than what is negotiated, then we would have to make up the difference. We'd have to subsidize those premiums.
So the way, yes and no. And the reason I say that is because the IPBC comes back and says, okay, your total premium, not employee and employer, but your total premium is $7.2 million or $7.4 million. And then we decide, not decide, but we make a recommendation to the board to say, okay, how do we cost share that between employee and employer? Most of our, I believe all of our labor agreements have a minimum that we set that says for single coverage, the plan or the employer pays 80%, the employee pays 20%. But again, in the past, the board has said, well, we don't. The premium increases were a little more significant, and so what the board had said was let's subsidize that. So what we're waiting for is what is the unit cost premium back, and then we'll be bringing forward to you a recommendation that says, okay, for a If we choose $1,000 deductible plan, this is what the cost would be to the employee and the employer. Then when we bargain that in future years, if that comes back higher, then that would be a decision, do we pass that on to the employees, or is it another subsidy by the board, just like if we were self-insured. So we just don't set the unit cost, they set the unit cost. Does that answer your question?
It does. I have a second question.
Go ahead.
So then, will you be as involved as you are now with healthcare, like claims and the administration part of?
So a lot of our involvement, probably not, in that if there is a question from like for the HR team, for example, if there's a question from an employee, we don't say, oh, well, our health plan says X, Y, Z. We have to refer them to Blue Cross Blue Shield because it's not a Peoria County adopted plan. It's a Blue Cross Blue Shield adopted plan. So those types of questions would go forward. Angela and I will still be involved. We get reports from the IPBC in terms of how are we doing with regards to claims. And we need to stay somewhat involved in that so we can say from a wellness perspective, which we'll talk about here in a little bit, if we're starting to see a spike in heart attacks, what do we need to do from a wellness perspective to kind of help negate some of that? So.
Okay, good questions. Any additional?
One more.
Sure.
Yeah. I know when we were talking about healthcare a long time ago, one of the benefits to self-care is we own the data.
Correct.
Do we give up some of that with the pool plan?
We will. We will get a number of different types of reports from the IPBC, probably more than what we would with a standard fully insured model, but we will not have quite as much data at our fingertips as what we would need, but we will still know premiums and things like that. The other benefit of the pool versus a fully insured is this pool, I believe, runs our premium data from a May to May. And so we should, in theory, no, we haven't been through it yet, but in theory, we should know what our premiums are early on in the budget process versus the fully insured. A lot of times you don't find out till November when we've already done our budget. So that was another benefit from a reporting standpoint as well.
Okay, thank you for the questions. Any other questions from committee members? This is a very important one. Obviously, it impacts all of our employees who enroll in our healthcare program. And, employees have the option to enroll or opt out. Hopefully this will give them a better selection, meet their needs to enroll and continue working together. That's one of the things as we opened this thing up at the HIAC was, this is the employee's plan. We're not here as a committee or board to define a plan for them. We want the employees and the key HIAC members to go through the facts and details. And what Shauna articulated here in this brief moment was, like, say, weeks and weeks of data that they did as a team, individually. So there's a lot of work behind the scenes. And again, I can't overemphasize the work that the team did. And Unland was a great resource. Bonnie and her peer Bill were here providing resources, and the depth of knowledge that Shauna and Angela have in this, and Vicki and some of the other new HR team members will have in it, is amazing. So as one person on that committee, I was very impressed with their knowledge. So, this is one of the, we're trying to meet the expectation of the employees to be the employer of choice and retain good quality employees. I'm going to pass around one more time for questions before we take a vote, and also ask if any of the HIAC members would like to make any comments, or Bonnie from Unland would like to make any comments. Jennifer.
I'm sure you said this, but I must have missed it. Do you know, or did you say what the timeline was for when we anticipate those numbers to be calculated?
We hope to get those within the next week, because we need a week or two to kind of do the models and do our due diligence, and then we're going to have a HIAC committee meeting to say we went in and looked at the plans and with HIAC to say, because some of the feedback, about half the people said they wanted a lower deductible with a higher premium, or a higher deductible with a lower premium, right? So we went in and tried to find those that kind of fell somewhere in that middle section. and have some plan choice offerings. So we've asked them to model 4 different plans, thinking we may offer anywhere from 2 to 4. And so I think that's partially what's taking a little bit longer, is we asked them to do a couple additional plan options. But our goal is to bring something back to this committee for the August set of committee meetings for adoption in September, because we need to be able to run open enrollment. So,
Thank you.
Mhm.
Any additional questions from the committee? Anything from anyone else? Bonnie, any comments?
I'd actually like to say thank you. I'm quite impressed.
Give her the mic, please.
Committee members,
Bonnie, if you could use the mic, thank you. No, it's for public, we have a lot of
I
viewers
can't wait
wanting
to
to
tell my
watch
husband
you.
I'm not such a loudmouth. Anyway, I would like to say thank you. I've been quite impressed with the committee members participating, bringing good questions, having us drill down and get into some details to meet their needs and their department needs. So I really enjoyed that. And kudos to your administration department here, Scott, Shauna, Angela, Vicky. They have a good handle on this. They handle the day-to-day operations. They've been doing it for years, or decades, I might say. They know their employees here. That's key. They bring a wealth of knowledge and experience. They only draw upon us as consultants when needed. So it's a pleasure working with all of you. Thank you.
Well, thank you, Bonnie, and also give Bill a thank you too from behalf of the county. And we still are not done, so we'll be using your services to bring this all the way home. So with that, I'm going to ask the committee for a vote. All in favor of this proposal with the sign of aye. Aye. Those opposed with a nay. Great, that passes, thank you. The next item that ties to this is a approval of a 5-year contract with Empower Health Services to provide wellness services. So I need a motion to put this on the floor. All right, Nate Hare and Ms. Coates on this one. So I'm going to pass this one over. Angela, you'll field this one?
Yeah.
Great, thank you.
So in front of you, we are talking about our wellness vendor. So as Shauna indicated, we went out for RFP, obviously for the health insurance, but then also one of those was related to our wellness vendor. So currently we are with U.S. Preventative Medicine, and that contract's set to expire. We've been with them for 5 years. They are the one that provides us with our wellness portal, various tracking points, tracking systems, educational tools, coaching for our employees related to wellness, as well as lab services. So with our RFP, we received 9 proposals. And again, working with staff worked with Unland as well as with our HIAC committee, we presented those proposals and kind of narrowed down to the best option for our vendor. So going through that, HIAC did recommend to staff, and staff concurred that Empower Health Services would be our selected vendor. They did present a 5-year contract for our wellness services, which again, that proposal will include wellness challenges, incentive programs, a very robust online portal, on-site wellness clinics, which includes lab work as well as a health risk assessment for our employees. It also happens to be Empower Health is also works with and is contracted with IPDC for their wellness vendor. So there are going to be some of those additional wellness services that the employees that are on the employee health plan will also get to participate in. But obviously, this vendor is going to be for all of our employees, whether you're on the the county health plan or not. So it is something that we'll be able to offer everybody to participate in. We were really pleased with Empower Health Service again with their online portal with the various types of incentive programs that they had, as well as event offerings. Empower Health offers their fee. It's a fee based on participation. So, our monthly invoice could vary based upon the types of wellness events that we have going on. Again, based upon how many employees are working with coaches, or participating in the different events. So they're really focused on participation and obviously the health outcomes. So we're excited to partner with them after your approval, of course. Happy to answer any questions.
Any questions from the committee on the wellness resolution? Dr. Blair?
Just quickly, and maybe you said this is open to all employees, whether they use our health insurance or not, right?
Correct, yes.
No. Good question. Any other questions from the committee? You know, I think one of the things that the HIAC members really engaged in and appreciated was the tie to wellness and health insurance and health outcomes and cost and their results. If you have a good wellness program that really inspires employees to make good decisions, make good choices, provides them the right support, at the end of the day, their lifestyle's better, their health's better, the outcome for the county is better because we've got healthier employees that are performing. So I think everyone was well aligned that having a wellness program was a critical piece of the puzzle. So again, kudos to the team on that. No other questions? I will ask for a vote. All in favor with the sign of aye. Those opposed? All right, that passes unanimously. Okay, we will move to public comment. Anyone have public comment today? Seeing none, we will move to miscellaneous. Any miscellaneous items for the committee? All right, seeing none, we'll adjourn. Thank you.